Thanks for the opportunity to speak today. We are really lucky and excited to have this monoclonal antibody clinic up and running. It is so important to have treatment options for patients in the outpatient setting. While we are rounding in the hospital, I can tell you that we see a number of patients and realize, wow, if this patient had gotten a monoclonal antibody, they might not be in the hospital. And there are criteria that have to be met. And so it's always unfortunate when you see somebody in the ICU on the ventilator and realize, well, this person would have met criteria for getting the monoclonal antibody, and they didn't, and now they're in the hospital. That doesn't mean monoclonal antibodies will prevent every individual from getting admitted or being hospitalized. But whatever we can do to prevent hospitalizations and especially to prevent serious illness, we definitely want to do that. So, a couple of thoughts about who should get monoclonal antibodies, and there's some very specific criteria that are laid out. In general, we would love to offer monoclonal antibodies to anybody who has had illness that has onset within the last 10 days and has risk factors for more serious illness. And the risk factors can include just being over 65, having a BMI greater than 25, so that it just means the tiniest bit, a little bit overweight, and of course anybody who's pregnant. Right now, how do we prioritize that? What I would say is if you've had a recent exposure and have any concern that you have a risk factor for more severe disease, just go visit with your doctor or go to urgent care and have that person make an evaluation and make a referral. In the setting where we have limited resources, what are the top priority groups? And those would include anyone over 65. If you have a new case of COVID and you're over 65 and you have not been vaccinated, this is what you need to get. And then another group is pregnant women. So we have seen, unfortunately, multiple deaths in the hospital of women who are pregnant. That should not happen. So if there's a woman who is pregnant and has not been vaccinated, she should get signed up for the vaccine today. Make the call, go to whatever clinic is needed, go to the drugstore, get the vaccine. If a pregnant woman is diagnosed with COVID-19 and has not been vaccinated, she should absolutely be a priority for getting this monoclonal antibody. Anybody over the age of 50 with risk factors, and then finally going down to age over 18 with risk factors. So please do not hesitate to reach out to your provider, urgent care. We want to do whatever we can to get people to have access to this monoclonal antibody. And we even have the opportunity to give it for post-exposure prophylaxis. So what I was talking about before is really for somebody who has acute illness, but if you have had a significant exposure to somebody who has had COVID-19 and you have not been vaccinated, you also are potentially eligible to get the post-exposure prophylaxis in the form of monoclonal antibodies.